If we can go ahead. Thank you very much. Today's presentation from the Library Science Talk series will be from Céline Racine, and she will be speaking with us today on the topic of improving the quality of research data through active data curation with the implementation at Unisanté. Céline, the floor is yours.
Thank you, Catherine, and thank you for the invite for this presentation. I will share my screen and you should see it now.
Yes.
Perfect. So, thank you. So I'm Céline Racine. I am the head of documentation and data unit at Unisanté, which is the University Center for Primary Care and Public Health in Lausanne, in Switzerland. I will talk to you about data quality through active data curation. This was my master thesis done a few years ago, so I will explain you the thesis and then show you what was implemented at Unisanté. So to begin with, a little context, if you here. So Unisanté is, as I said, the Center for Primary Care and Public Health. This is a medical center, but also a center that does research and teaching at the university level. We have around 1,000 employees, 400 for research. We have, as I said, medical consultation, patient consultation, but also a big activity in research. We have around 400 journal articles per year. We also do mandates and expertise for external institutions. Our area of research are public health, occupational health, vulnerable population, promotion and prevention in health, and a lot of research about primary care, vaccines, and travel health. On my side, I've been working there for 10 years. I've begun as a librarian and webmaster, and then my role evolved to do data management. So I became a data steward, and 1 year ago I was promoted as a head of documentation and data unit. So now I work with a team of 4 people with the library. So my team is handling the scientific library, research data management support, and literature review support. But today we are not talking about my library and my team, but about the master thesis and its implementation in Unisanté. So you can find my master thesis on Sonar. You have the link just here. It was handled in 2022, so 4 years ago. And the idea was to improve the research data quality by facilitating active curation. So again, a little context, we were in 2022. So at the time, we had already some support for research at Unisanté. We have the roadmap. I will show you. This is a public resource. If I find my app. So the roadmap is something that Unisanté developed for years, and this is on our public website, and you can find quantitative and qualitative data support, research support. Sorry. So this is a synthetic description of how to conduct a research project. And for each step, for example, literature review, you can click and you will get information about good resources, good practice on how to, for example, search grey literature. So this was one of the resources available in 2022. We also already have the specialized library and the documentation and data unit, and 12 research support services in various areas: legal and ethical support, research data management, and IT support. We had a lot of units in methodological and scientific support, and of course administrative and financial support. Sorry, I have trouble to change slides. It's not working anymore. Oh, here we go. Sorry. So here is the research support entities that we had and still have now. So I put in bold the my unit, documentation and data unit, and the research promotion unit. Why? Because this is the two units that are very central in Unisanté. And for any question related research support, you can go to these two units that will then transfer your demand to the other units. We are not a network. We have all different hierarchies, but we try to collaborate. At this time in 2022, this collaboration was not existent. Everybody was working in their corner, but you will see that through everything that we implemented, now we can communicate really efficiently. So the problem that led to this master thesis was the data quality at the sharing stage. At Unisanté, we have an institutional data repository that is managed by my team, by myself, and I saw that 40% of the datasets and the documentation related was in really bad quality at the time of data sharing. When I said bad quality, it means that it needed data curation, heavy data curation from us. We had direct identifiers. We had encoding problems. We have no documentation at all for these datasets. So really, it needed a heavy work from my unit to put them in the data repository and to make them at least a minimum FAIR compliant. When I asked the research team why they delivered such bad datasets, the answer was, we don't have time. We don't have time for this. We are beginning a new research project. This is an old one. I don't want to treat my data. And moreover, we didn't have any institutional policy, no guidance on what quality was required on the data repository. So I've decided to do this master thesis to identify what could be done. And during my explorative research, I found an article that was really interesting from COVAX. It was they identified all the errors and mistakes in research data management and when they occur. And we can see here that a lot of problems will appear at the beginning of the project or during the research project and not at the end. When we see that when we can already handle some projects when we share the data, but a lot of them can be avoided at an earlier stage. And with this, to avoid this error, it's active data curation. It's the notion to put good practice of data curation and archival principles in and to apply them in an earlier stage of the research project to document, to create the codebook or the data dictionary at an earlier stage, to choose at the beginning open file format instead of working in Excel and convert that at the end. It's a lot of the good practice we already advise, but to put them in place at the beginning. So I have decided for this thesis to do a state-of-the-art of active data curation and to really list the activities. You can find all of them in my master thesis. I won't list them here because there are a lot of things to do. The other objective was to identify the practice at Unisanté. Are these good practice already applied here or not? And give some recommendation for research teams and for my institution, because of course we can't do the research teams won't do all the work. There are problems within the institution that can be handled. The methodology was a literature review, then a survey for the research teams and interviews with the research teams and with the research support services. What is interesting here is that it was in 2022. I show you that we had 12 research support services, but in my master thesis, you will see only 5 interviews. Why? Because even myself, as a data librarian, I wasn't able to identify all the research support services in this institution. So even with my place, I couldn't find everybody that was related to data quality. So this is interesting for after. So the key findings were that good practices from active data curation were existing, but not evenly applied. There were a lot of good practices were done for data cleaning and data analysis, but I saw that all the recommendation regarding documentation, anonymization, and data protection and interoperability were not applied correctly or only at a later step of the research project. I also identified the needs from research team, and the need that really pops out was that they wanted a human support. They didn't want an e-learning, they didn't want a tool. They really wanted somebody, a real person to communicate with and to have some support from. Finally, I did a mapping of all support services, so I will show you an example. Regarding the good practice, you can see here all the practice that I interrogate. So if I read some, you had how to write a data. Do you write a data management plan? Do you verify file integrity? Do you create a code book? Do you create new variables, or do you identify the re-identification risks? And we can see that in the data analysis step, so here I don't know if you can see my mouse, but we see that in the project in data analysis, the research data are really correctly handled. For almost everybody, do all the good practice, but at the time of data sharing, only half of the researchers really do something about their research project. The other output was this kind of data lifecycle. So we had one data lifecycle per support unit, and to match which activities was related to which step of the data lifecycle. This is my unit, so the documentation and data unit, and we see that we can act at various stages. So this was done also for other identified support services. But finally, with these two outputs, I analyzed all the data and had a set of, first I had the needs. So researchers' needs that were collected through the survey and through this method was the need to have a DMP support. The data management plan support was already existing for many years, and it was really a surprise to have this output here to say, oh, we really need support for data management plans because a lot of libraries do it. This is the #1 service, but it wasn't. The researchers weren't aware that it existed. Again, they asked for a methodology support that was already existing in Unisanté. They asked for support for interoperability because they realized that between two research projects, they never used the same coding, they never used the same questions, and therefore they weren't interoperable. Even for two research about tobacology, the question, how many cigarettes do you smoke? is never the same in each project, so they are not interoperable. They asked for support about anonymization. What is data anonymization? How can we do it? What is the difference between pseudonymized, de-identified, or anonymized data? They ask for data monitoring. So data monitoring is the automated way to check data quality while we are collecting it. And this can be done, for example, through RedCap. They asked for help to document and share their statistical scripts, statistical code between data manager because they want to reuse these codes. And of course, they ask for training and the guidance about everything related to data management. So this was the expressed needs. And for the institution, the challenges that I identified was data governance. At Unisanté, we didn't have any data governance, so we didn't have a repository, a registry of the data that were handled at Unisanté. We didn't have a centralized way to follow contracts. We didn't have we didn't have a data protection officer. We had really nothing about data governance except my unit, which is just support for data management. Another problem in Unisanté that was highlighted was the documentation and file organization. We have an internal server, but each team was free to organize their documents where they want, how they wanted, with the security they want. So we found out that some projects with personal and sensitive data were accessible to everyone, for example. And this is a big issue for data security. We have, as I said, an institutional data repository, but it was also a challenge because at this point in 2022, this data repository was handled by my team, but a researcher that wanted to share the data couldn't just deposit the data and go away. They had to email my team, and then my team will create the metadata. And this was an issue because a lot of people said, oh, but there are other data repositories like Zenodo, and I can just upload my data set there. Why can't I use Zenodo or something like that, which seems easier? And finally, another problem was the archival system. We didn't have any ways to archive data. We didn't have something to follow the data sets. And moreover, we are submitted to the Human Research Act, which demands that we delete the data at one point. And there was no way to follow which data were deleted or not. So with these needs, with these challenges, and all this gathered data, I've produced a set of recommendations. The first one was to improve the visibility of services. We saw in the researchers' needs that they wanted DMP and methodology support that was already existing. So the idea was first to give some visibility to these services. Then one of the risks was the anonymization, because we saw that some data that were not anonymized were launched online on Zenodo. We find some data with names, with email address, with phone numbers from patients during COVID, and this is really not appropriate, and really this is a lack of security. So we decided to really strengthen the anonymization support. Then one recommendation was also to improve the infrastructure and the data repository, and to improve documentation and file organization. The other recommendation that are not implemented yet was data governance, to have a full data governance, but this recommendation takes time, and this is not implemented yet, so I won't talk about it today. To provide guidance and training, so this is always going on. I will show you some, but this is always something that we will develop with time. Improve the interoperability. So if you, one of the suggestion was to use RedCap. This is already a tool that we use here. And in RedCap, you can share some fields or some questions. So you have this possibility to say, okay, at Unisanté, for the question, what is your sex or your gender, we can have one question that can be reused in all our research project. This idea to develop some institutional fields in RedCap is still under thinking here, and maybe this is a project we will do next year. The centralized data monitoring, so this way to automatically check data quality while during the data collection, is not implemented and will not be implemented here because it is really complex to implement. This is really expensive, and it's mandatory only for clinical trials. And at Unisanté, we have one or two clinical trials each year. So this recommendation is stated in my master thesis, but not implemented. So this was the summary of the master thesis, but you're here to know what has been implemented and how. So I will go through the implementation we did. What is important here is that the library didn't do it by herself. It's really a teamwork, and a lot of the project were the idea of the library, but not realized by the library. So we took 3 years, so from 2022 to 2025, to do multiple actions in parallel, as this is not always the same team that did it. These implementations and this project were not only led by my thesis, but really by institutional needs. The master thesis helped to prioritize some of the project and to show the director of Unisanté that it was really needed and asked by the researchers. So the first recommendation we implemented was increase the visibility of research support services, and we did a lot of actions. We begin with recording videos of presentation of each support services. So we have 11 recorded videos. 11 videos of 45 minutes each. And in this video, each service will present itself, present their services and the cost. And this is interesting because we did it in a hybrid way. So you could see the video in live, but now it's also always available on our video platform, and you can always go back to see it. The second action was an onboarding brochure or booklet for new researchers that you can see here, the Accent sur la recherche. This is a booklet that will present important information for research. So all the context of research, the first steps to do as a researcher, for example, how to connect on the intranet, how to connect your institutional account with OrcID and something like that. But half of the booklet is dedicated to research support services to describe what they do, what are the services available, how to contact them. And with this booklet, it helps us to identify all the 12 research support services and to decide together how to communicate together. So everybody met, all the 12 research support services we met, and we've decided that we had one email for all. So we have support services, research support services email, and all the requests come here, and we distribute to the other ones. The third action we do is the budget review before answering a call from SNSF, for example. You have to do a budget to answer a funder call, and you can come to the research promotion unit, which is one unit here, that will help you to read all your proposal, help you they will guide you to other research support services. For example, in the proposal, if they see, oh, you have qualitative data, but your methodology is a bit weak, they will guide you to the appropriate support service. They will also recommend that you go to the documentation and data unit to estimate the cost of data sharing. They will estimate the cost of an ethical review and so on. So with this action, we see that we can really recommend some support services at the beginning of the project. And the impact of this action was really visible. We have an increased demand. The demands for budget review really exploded, and we have more and more support requests for all the 12 support services. Everybody with this booklet and with these videos saw that we have more public and we have more visibility. We saw also that we have a better awareness of DMP support and IT support, as this is really the two services that have the more requests for now. The second recommendation we put in place was the anonymization support, and this action was only done by my team, by the documentation and data unit, aka the library. So what we put in place was awareness events. So we put in place a series of coffee breaks. This is small talk of 15-20 minutes about one library subject. And we did multiples on anonymization, but anonymization is a wide subject. So in the coffee breaks, we only speak about one aspect. For example, what is the difference between anonymization and pseudonymization? And we put in place some conferences of 45 minutes to talk about anonymization in a wider way. So we had one about introduction to anonymization and a second one about how to do anonymization and assess anonymization. We also put in improve the anonymization support with a service, which is a professional anonymization service, also done by my team. So at first, we just answered questions. So we just did consulting about anonymization, but now we can process data and anonymize data, which is very useful because sometimes you collect data and you don't have the consent to reuse those data in a future research project. So at this time, if you don't have the consent, you are obligated to anonymize the data, and therefore the researchers can come to us and we will evaluate if such anonymization is possible and then treat the data for them. We can also do some validation, some assessment of the anonymization. Of course, here it's only my team, the documentation and data unit, but we are not god of anonymization. So we will collaborate with other institutions like the university hospital or with the social with FORCE, which is a center specialized in social sciences, where they have other anonymization experts like me, and we can really communicate and collaborate for difficult cases. Finally, we also put in place an internal committee to act like a data protection officer. This is not one person, this is 3persons, one from IT, one from legal service, and one from ethical support. And they took this role as they give advice about data protection, and they can help with risk validation. This is the most difficult here because it's a first step in data governance, but it's difficult to put in place without additional human resources. Here we had to do this with existing people, but in the long term, I hope that we can hire somebody to get this role free. So the impact about this anonymization support is that, of course, we saw an increased demands for anonymization service. We have, for example, the physicians, so the medical staff that came to us, so not people from research, but they came to us saying, okay, I have this patient consultation. I want to hire a student to do a master thesis about this aspect. Can I anonymize the data so that we can do a master thesis or a bachelor thesis? So this is the kind of demands we have right now. And we see also that the awareness events and all the information we gave really improve the understanding of anonymization, as we help reading the protocol and the proposal at the beginning of the project. We see that we have less and less errors and mistakes between the term anonymized, de-identified, or pseudonymized. And we are happy to see that the differences are really getting stronger. It's still complex, it's still difficult. That's why we don't have a 100% understanding, but it's going on very quickly. So I can only recommend you to train your researchers and to explain them the problems of anonymization, the risk, and the differences between the terms. The third one was was the standardization of file organization. So we created a folder template which is inspired by the tier protocol. So here it's not the documentation and data unit that handle this, but another team. And they created really a reusable template depending on the law that is applied. So if you have a clinical trial, you will take the first, the HRA or clean template, or you will take the other ones for other research projects. To give you a small overview, it will look like that. Each box is a folder, and we have one major folder, which is the project. And in each, and then you will have always those mandatory folders: governance, planning, realization, data stats, and valorization. With this, you have a procedure that will explain you which documents goes in which folder. This was a big challenge, but it has benefits because it will improve consistency, ease collaboration between, because we have the department that collaborate. So if they organize their files in the same way, it's easier to collaborate. It's better documented, and it facilitates archiving, as we know which folders need to be archived and which ones need to be deleted. It's a challenge for adoption because we have some resistance. It's difficult to change the practice, and this is really difficult, but 25% of the researchers adopt it and are happy about it. Finally, the data repository. So we decided to update the data repository in 2024. I will show you how it was done. So we updated the way to document the metadata. at the beginning, before 2025, the researchers will write to my team to say, okay, I want to share my data set. We will send the researchers a Word file to fill in, and then the researchers will transfer us the Word file with the metadata and all the documents like the data dictionary, like the questionnaire in PDF. And then my unit will go to the data repository, create the XML, the web page, and the DOE, and then publish it all. So it was really back and forth with the researchers. It really took time. Now, since the update, the researchers can connect directly on the data repository, fill in an online form which resemble to the Word file, but which will gather all the metadata needed, and they will already send the PDF of the questionnaire, the data dictionaries, and so on. Then my team will connect to the data repository, check if the metadata are complete or not. Sometimes we will enrich the metadata if needed, and then we will publish the web page and publish the DOI. We have, with this new way, we can also have advanced metadata. Advanced metadata are the variable dictionary or the codebook that is translated into XML so that you don't have to download a CSV file to discover the variables. You can just go to the website and click and compare variables from different datasets. Unfortunately, it's not already online, so I can't show you this today, but I hope that in a few months it will be online. So these actions will help to have a self-deposit interface for researchers with an assisted metadata entry. So with this online form, they have help text and control vocabularies to put the metadata. The XML generation is automated. Before it was manual, and as a human, we only validate. So the impact is huge here because we went from 3 hours work to produce the metadata to 30 minutes work per data set. So for us, it's really huge, and this is why we can now dedicate this time to other work for data. Now we saw also that we have fewer correction, fewer back and forth exchange with the researchers, and the metadata quality were really improved because researchers understood what they have to put in each box because of the help text. These were the recommendation issued from my master thesis, but Unisanté went further with 3 other project. So now we put in place in 2023 the Concept 3. So this is a peer reviewing of project proposal. As an institution, we gather together the researchers and they do some speed meetings to talk about their research and to challenge research idea. And in a second step, they can submit the proposal to the same peers that will read and comment the proposal. We also put in place RDUs, which is an internal registry for research project and which is used to track all the data and to manage the risk of personal data in the institution. And in 2025, we launched a research website to present really research at Unisanté in English. So I'm going to an end of this presentation, and the key lessons to keep is that awareness is the first step towards quality. With this master thesis, I had a lot of ideas about tools, about process, workflows to put in place, but of course, I couldn't put them in place because nobody knew why it was important, what was data anonymization, what was data quality. So the first step was really to communicate about this subject and to communicate about the existing support in place. And we saw that it already improved the data quality. The human support is essential. You can't delegate everything to a tool. The researchers want they want a human to communicate with. Standardization improves quality. We saw with the folder organization that it helps, but the adoption takes time and there is no one fit for all. We always have to do some adjustment. Finally, what I saw is that implementation must be done step by step and not rushed. We can't do everything at one time and we can't do everything by ourselves. So it was interesting to see that step by step we are getting to a better data quality, but we can't switch from bad quality to good quality in 3 years. Finally, active data curation is not only a concept, it's really good practice to put in place during the research project, and it can be progressively implemented through targeted action. But awareness is the first step. If you just communicate about active data curation to the research team, they will put in place this practice really quickly. Finally, and a word for the librarians here, the library can't do it all. It's a teamwork for us to implement these 4 recommendations. I've worked with the ethical and legal support, with the IT support, and with the methodological support to put this all in place. So I hope you enjoyed and understood me. And now I'm open for questions. Thank you.
Thank you very, very much.
You're mute, Catherine.
So sorry. Thank you very much for the presentation. One of the questions that came to mind is for some of the things such as naming of folders or other policies for archiving and records management practices. Is the library mandated to do this, or is it all dependent on voluntary following of the best practices?
For now, it's on a voluntary basis. We did some procedures, so it's highly recommended to follow them, but we can't check, unfortunately. But at the time of the archiving, we will check. At least for the data sharing, we modify the file namings, and when we have the hand on the data sets, we will change the names. But of course, for the researchers and for the active curation, this is all on voluntary basis. The only mandatory thing is that they have to announce their project to the financial to the finance to check, but this has no impact really on our services. And the other one is this RDUS, this internal repository, which is used for data protection, and this is mandatory for them to announce their research project once it has been launched.
Mm-hmm. And following that, a question regarding one aspect related to data repositories sometimes is how long can you keep the data, and what kind of it touches on the anonymization. Whose obligation in the organization is it to know how long things can be retained and whether it can be retained? Does that fall to you, or is it expected that somewhere else in the organization will drive that?
For now, it's shared because we know by law how long we have to keep some data. When you are submitted to the HRA, it's 10 years, and then you have to delete them. And so that we now have the problem of some research that has reached this time, and the researchers has gone. And so now it's for now it's up to us, and this is one of the questions that I hope will be handled soon by data governance, because for now it's me and my team we decide, but this is not really correct. On an ethical point of view, we use the consent, and if in the consent it was stated that the data will be deleted, we delete them. But it's a difficult process, because we want to say, oh, we want to anonymize the data to keep using them, but anonymization is now so difficult that it's really impossible to do it for everything we have. We have a lot of data sets, and we don't have the consent. We have really medical data that we can't aggregate. We have to keep this fine data. And unfortunately, anonymization will remove everything we want to keep. So it's really difficult for now, but we are discussing it to decide who has the responsibility to delete this data at the end of the project, who is responsible to keep them. And we try to discuss also with the ethics committee in the canton of Vaud, because it's also wider than just the application of the law, because the term anonymized data has been used a lot, but it has evolved for the 10 last years, and we want to keep de-identified data and not anonymous data for research only, and this could be improved in the consent and in the way we interpret the law.
There's a question in the chat. I was surprised to hear that self-deposit in repository led to less workload for the team. I've read some articles that suggest the opposite typically happens. What do you think were the main factors that led to this? You mentioned that the new online form had help text that clarified metadata entry for researchers. Was there anything else you did that you think made it easier for the researcher to submit better metadata, or that led to this reduced workload for the team?
I think that it was first the online form. Before this online form, we did everything by hand for the XML metadata. And this was really difficult, because I'm the only one trained with XML here. So I had to train another librarian, which was not really used to XML. And creating an XML by hand is not really easy. We had another software to do this, but in Unisanté and the University Hospital, we can't install softwares on our laptops. So even if we could do it through another tool, we couldn't. So it was difficult. So this is the first step that where we gain some time. It was the XML generation, and we did coffee breaks, a small coffee breaks about metadata and what is important, and a lot of people followed it, and now watch it before submitting the metadata, so that they understand what we want in each field. The third one was that we authorized the copy-paste of information from the protocol, because we don't use the Dublin Core metadata. We use the DDI, so Digital Documentation Initiative, which is a very big metadata form. You can give a lot of information about data cleaning, about sampling, and so on. And we authorized that for this section, they could copy-paste information from the protocol. And this was really useful, because at this point, they said, oh, I don't have to re-explain everything. I just can copy-paste from my article, from my protocol. And now we have better metadata, because before this was a job done by my team. We read the protocol entirely to copy paste or to reformulate, and this is where we really gain some time.
Thank you. There's another question in the chat. This question is related to who can lead these conversations. As institutions strengthen their data stewardship capabilities, do you see greater value in developing highly specialized data stewards with the expertise in healthcare and clinical research, or in training more generalist data stewards who can support data management, fair practices, and research data governance across multiple disciplines? Which approach is more effective for promoting and scaling data stewardship at the institutional and national levels?
It really depends. For the institution, it depends on the institution. Here at Unisanté, as we are in the health field, specific data steward with expertise or experience in health related research is better. I don't say that we have to hire people that has done health research. You can really be a generalistic data steward and train yourself about this subject. It's not a problem, but the more specialized you are, the better you will communicate with the research teams. So generalistic data steward that will promote good data management practice and will handle projects that are more generalistic are interesting in universities or in institutions that have multiple fields of area. For example, if you have like a university, you have various faculties, or if you are doing health and social sciences, it's interesting to have a data steward that can answer questions for everybody. But at a national level, we need to have both to discuss. It's not a one-person job. It's really important to have more people and to really have a discussion about everything. I don't know if I think that data stewards are really important because this is the person who is between IT and between legal and the researchers, and we have this knowledge of all the fields and all the problems, and we are really the person who can lead this kind of projects. But we can't do it all, and we really have to work as a network and to work together at a national level to really have the same values and the same practice.
Thank you very much. Anybody else has any additional questions, please feel free to drop them into the chat or go ahead and raise your questions now.
And of course, if you don't have a question now, but later, you can still always add me on LinkedIn, and I'm happy to answer your question or discuss with you at a later point. In French or English, but not German. Sorry, I'm not very good.
While we wait to see if there are any other questions, one last question that I personally have is for institutions that are just looking at trying to speak to their institutions and put such things in practice. Where do we begin? If we don't necessarily have a foothold in these conversations yet, where do we start? Do we start with making sure everyone knows about our services? Do we start with creating networks within the organization? Where do you suggest we begin?
I think that connecting people between the organization, if you have multiple research support services, is a good first step, just to identify everybody and check if they have the same ideas than you about data governance and data quality. Awareness of researchers is also important. And for me, the first step for my hierarchy and really to prove that it was important was data anonymization and data protection. We have laws now that can help us. And it's really scary for your institution if they understand that some researchers put names of patients, or if they put confidential data on a data repository or on the web, on Google. If you have a proof for that, it's really a shock for them. For me, I had a data set that was on Zenodo with names, and I just took it, I downloaded it, I put it in front of my director, and I said, "This is a problem." And it was a shock. They didn't do anything for 2 years, but then they said, "Oh yes, it's important to handle data protection." I think this is what I saw in all institutions that is doing research, is that anonymization is not correctly understood, and it leads to really high risk error mistakes. And this is a way that we can put a foot in the door and say, okay, we have to do that. But really, if you have support services, connect with them and check what are their ideas, what are their problems, are they visible enough? And with this, you will really have allies, and you will be work together.
Thank you very much. As the session comes to a close, I want to say thank you very much to Céline for this presentation. It's been very, very interesting and very beneficial for all of us. The recording will be made available from our YouTube channel as soon as possible. We would like to invite you to the next Library Science Talk. We have a brief break for the summer period, and our next talk will be in late September, this time focusing on taxonomies, called Building Taxonomies from the Bottom Up and Top Down. And that will take place on the 29th of September. So again, thank you everyone for your participation today. Thank you very much, Céline. And we look forward to everyone joining us with our next Library Science Talk later this year. Thank you again.